I don't take nothing that a doctor don't prescribe. I just take Paxil, Xanax, Zoloft, Flomax, morphine, Valtrex, Flonase, Plavix, codeine, Zyrtec, Zoma, Zantac, Ultram, Zocor, Zipro, Prozac, dopamine, Demerol, Lexapro, Tylenol, Vicodin, Lyrica, Lipitor, and Adderall, but I don't do no drugs, man.
Hi everyone, and welcome back to another podcast episode. Of course, I'm Dr. Beard, Anna Allen, the Anna Allen. So happy you've joined our team because you've made my life so much easier. And you've just brought so much to the table too. To the table, right?
To the table, yes.
To the table,
Yes.
including this podcast. And so today what we're going to talk about is medication weaning, because this is something that we work with our patients from pretty much the get-go. And because you got to get off these things. If you truly want to heal, you have to get off the pharmaceuticals, because when you're working with a functional medicine doctor and you're trying to get well, you're often just battling the effects and the side effects of the medications. Mm-hmm. And so, now I'm not saying that you can't make strides in your health and get things working a lot better while still being on some of these meds, but your body's never going to reach that state of total wellness when you're on these pharmaceuticals, because they all have side effects. They're all manipulating your body in not so good ways.
Right.
And they never address the root causes. And some of them can often greatly hinder the healing process. And a lot of people aren't even aware of the side effects that they're causing because they've come on so gradually. And often they are causing the very symptoms for what they were being prescribed for. Mm-hmm. Like antidepressants and anxiety meds, for instance. People are like, well, I'm still anxious, I'm still depressed, I need that medicine. Well, that medicine is actually now contributing to that. And it's a hard one to grasp.
Yeah.
But if you look on the side effects of these meds, those are common ones.
Yeah. And I love that we're having this conversation, because I had a recent discussion with someone who kind of described this cycle of medication, mm-hmm. where they're getting on one medication for something and then they have another symptom pop up. So the obvious solution is another medication. Right. So before they know it, they're on 5 different medications, all for different symptoms, which are likely contributing to each other.
Yes.
Yes.
It's frustrating. And when someone goes, I'm just going to go to the doctor and they're going to put me on a medicine, and I'm like, okay, it's going to start with that one, mm-hmm. and then there's going to be another one and another one and another, and it's almost as always the case.
Yeah.
Or you can have a medication that you're on, you stop it, and then you notice issues later on that develop that were due to that medication. So it can take some time for the body to rebalance itself, even once you stop taking those.
Yeah.
And some of them can be difficult to get off of. Some of them are much easier. And we kind of made a list of the ones that we work with patients, the most common ones that we work with patients to get off of. Mm-hmm. And so you've got a nice little list for us, like you always do.
Got to have a plan in place.
Yes.
But, there is a lot of medications that I think are affecting young and older generations of things they're getting put on. Maybe they're told it's age, from blood pressure to PPIs when you're older, to younger generations where now it's birth control and antidepressants.
Your genetics.
Yes. So I think this is a good conversation for all audiences, because we're all being handed a lot of medications right now.
Yeah, and they always default to it's your age or your genetics, because they don't understand root causes. Mm-hmm. That's their default. And I'm not saying that there aren't things that aren't age-related. Menopause is certainly age-related. It's going to happen for women. And yes, could be small genetic predispositions, but that does not mean you are going to get this.
Right.
It just means you're predisposed.
Right.
We all have predispositions. It doesn't mean that we need to walk around popping pharmaceuticals.
Yes. Yeah.
And but that's the allopathic model. That's what doctors are trained to do. You tell us a symptom, we diagnose you, and then we give the appropriate medication based on that diagnosis.
Yeah.
sad, but
It is.
um,
So yeah, there's a lot we can dive into. First, talking about blood pressure medications, because that is something that is becoming more and more common, and people just, maybe it has been common, but it's just, there's a lot of people on blood pressure
yes,
medications.
and for multiple reasons. Gosh, the worst thing you can do is put a patient on a blood pressure medication with a reading done in the doctor's office. Most people are stressed out, they're anxious, they've been waiting forever, they're angry.
Yes.
They're thinking about all the things that they could be doing at work while they're waiting an hour and a half to see the doctor. Your blood pressure is going to be elevated, and I've seen a lot of people get put on blood pressure medications based on that alone. That is, don't let them do that to you. You need to be taking your blood pressure at home in a rested state upon waking. In the day after you've sat in a dark room for about 5 minutes, take your medication. I mean your blood pressure, not your medication.
Not your medication.
Your blood pressure, and always in a non-caffeinated state. How many people are going to the doctor in the morning after they've had, a stop by Starbucks, and then they get their blood pressure taken and it's high? I mean, come on. And the doctors are never asking about that. I mean, some do, but not all. So that, white coat syndrome is definitely a real thing, and that's one thing that I see that happens a lot. I also see people who have anxiety and nervousness. Well, that's going to make your blood pressure go up. But it doesn't mean that you have just this primary hypertension. Okay? That just means this happens in states of nervousness.
Right.
And so what do we need to do? What is causing that nervousness? You don't need to be put on a blood pressure medication for it. We need to address what's making you nervous and anxious, there's a lot of things there. And then I often... they've changed the blood pressure parameters over the years. 135 over 85 was acceptable. That was normal. And now it's 120 over 80. So, of course, more people are going to be on blood pressure medications when you base it off of those parameters. When I was working in the ER, I would see little old women or men come in there on a low sodium diet and 3 blood pressure medications, and I would see them because they had fallen, hit their head, or broke a hip. So now they've got a brain bleed, a concussion, a broken hip, something broken because of this having to keep a blood pressure of 120 over 80 for someone who is 70 and 80 years old. You need a higher blood pressure when you age to perfuse your brain and your extremities. And there's tons of research that shows how well patients do when their blood pressures are allowed to be at that higher level. You're not going to stroke out if your blood pressure is 140 over 85. I've never ever seen it. Of course, your blood pressure fluctuates throughout the day depending on your activity and even the time of the day. Your biological circadian rhythms often will dictate your blood pressures. So there's a natural rhythm for your blood pressure, your activity, what you're eating, caffeine, your mental state. These are all things that are going to affect your blood pressure. So you must keep that in mind as you are doing self-monitoring, which is what we have our patients to do when we're trying to get them off of these blood pressure medications. And it's usually the easiest ones to get rid of. We start with one, we tackle it, we like, all right, let's cut it in half, see what happens. I need you to monitor your blood pressures. Lo and behold, you don't need it. Woo,
Right.
Look at that. You actually feel better, And so we just kind of work on down the line. And occasionally we have the patient that, we've taken them all and they just, for whatever reason, they have to be on it. And there's always a reason for them needing that blood pressure medication, a reason that can be addressed through a functional medicine approach. Often they don't like our advice on how to do that. A lot of people are very toxic. They are carrying high toxic burdens. They are living within a moldy home. They have breast implants that are causing a lot of inflammation, or they just have a lot of inflammation in general. And so once you start addressing those things, so the blood pressure starts to become manageable and medications aren't necessary. Of course, we all know about magnesium and nitric oxide, and I've just seen so many people improve just their lifestyle choices and get off the blood pressure medications.
Yeah. And that's good to know too, that this is something, you made two good points. One, working with a functional medicine provider, so you're not doing this alone.
Right.
You're not just cutting cold turkey, seeing what happens, not changing your lifestyle, but it's like a two-pronged approach.
Yeah.
Like you're getting guidance as you're coming off these medications, but you're also making a lot of lifestyle changes.
Yes.
To where you
At the
don't
same
need
time.
that medication anymore. So it's not just like you shouldn't be on medication, keep doing what you're doing. It's, you should get off the medication, but there's gonna be steps that we need to take.
Why is your blood pressure elevated?
Yeah.
And like I said, there's a different reasons for different people, but you just have to start attacking what the obvious things could be, and then start trying trial and error of, all right, let's cut half the dose, see what happens. I need you to monitor your blood pressure, and take your blood pressure correctly. There's a lot of people who aren't taking their blood pressures correctly. A functional medicine cardiologist from Vanderbilt, I listened to him at a conference, and he was talking about some of the things we've already talked about, the white coat syndrome and things like that. But it's imperative that, if you're using one of the wrist cuffs or an arm cuff, it needs to be at the level of your heart. If it's up here, or down low, hanging, you're not gonna get a right reading. And so you have people just, sit in a chair, feet on the ground, arm out at the level of the heart, and take your blood pressure, and that gives you the best reading.
Yeah.
And so that's one thing with that we have our patients to do. We make sure they understand, because it's important. You want to have accurate numbers to base your decisions off of.
Yeah.
Yeah, but if you're in a blood pressure medication, one of the easiest ones to get off of. Thank goodness.
Yeah.
Yeah.
Okay, so moving to kind of, I guess, a more sensitive approach, especially right now, is glucose control medications. So for insulin, for diabetic patients, even to the point of like someone's pre-diabetic, and they're maybe getting on a medication. Where do you go from there?
Oh, wow. Yeah, so blood sugar control, again, an easy one to get people off of once you've addressed a lot of lifestyle issues. Some of the big drivers of abnormal glucose levels and insulin issues, insulin resistance, is stress and the HPA axis dysfunction, poor sleep, chronic worry, poor gut health. There's a lot of medications that cause diabetes. Statins cause diabetes. If you did not know that, you know that now. I have seen family, friends, patients who have taken these. They start taking them, and then all of a sudden their A1Cs start creeping up. Some of them start jumping up. And then you take them off that statin, and then they come back down. Not that they don't still have some issues that they need to work on, but a lot of medications can contribute to insulin resistance and elevations in glucose. But like I said, lifestyle interventions almost always can take care of this. It really depends on the glucose medication that you are trying to wean off of. They have different approaches, right? But you have to start somewhere, right? So you just start cutting back as best you can, a little bit at a time, monitoring your blood sugars. Using a continuous glucose monitor, I think, is an excellent tool to use whenever you're trying to get off of these medications. You're getting real-time data right then.
How is that, it's measuring plasma. So how do you see a lot of fluctuations versus like blood when you're
Not really. I think they're pretty spot on, because I have worn them while I was getting my blood drawn, and I knew what my blood sugar was right then with my monitor, so I was like, so what's it going to come back at? And it was almost the same.
Yeah. That's interesting.
Yeah.
And this is an interesting conversation. We could probably do a whole podcast episode on blood sugar regulation. But we've kind of seen this shift I've talked to family members about this recently. They're doing a lot of things right. Like they're eating whole foods. They're exercising, they're doing the resistance training, they're working on their stress, they're addressing all the foundations. If they go to the doctor and they're in the pre-diabetic range. And I feel like we've kind of seen this shift of healthy individuals get into that pre-diabetic range. So what causes that rise? And then that's kind of on the medication track, because
well, you just said it.
yeah.
Okay, so why did they even institute pre-diabetic range? Start thinking about that.
Right.
Okay, we're dealing with a industry who's constantly changing parameters and adding things to constantly be monitoring. And guess what? They've got the pill for you. So sometimes I'm like, yeah, it's good to know if your A1C is creeping up there. I mean, that's an issue. What's going on? And you look at it and you're like, okay, there's a lot of things to consider here. I know when I've dealt with people in the past with this, we had one gentleman who, man, no, it just seemed like no matter what we did, and he was doing all the right things, but he was a state trooper who worked shift work and had a lot of trauma that he was dealing with. I mean, you can only imagine what these people are exposed to. I got pulled over by one a few weeks ago and I was mad about it. And, but then again, I'm like, man, these guys have a hard job. And he was telling us some of the things what he had to witness that day. And I was like, whew, that's tough.
Yeah.
Responding to where there's, infant and children deaths and just some horrific social issues.
Yeah.
And he had even was working on starting a support group for first responders because of all the things that they're exposed to. Right. So, it was when he would go on a vacation with his wife and sit in a hot tub, he's like, my blood sugars are doing better. Yeah. I'm like, oh, well, ding, ding, ding. And he knew this. And he only had 8 months before he retired. And we're like, man, if you can just hold on. Just hold on, but just keep doing what you're doing because that's helping. But his was definitely stress and shift work.
Right, which I feel like that's not talked about just within blood sugar insulin resistance.
It's never.
It's always just change your diet, change your exercise routine. But you have people who are literally coming to the doctor saying, no, like you don't understand. I've done these things my whole life. This shouldn't be happening. And the only response they can give is diet and exercise. So I love that you brought up the stress, but it is interesting how most of these medications, like you said, you go to the doctor, you get it tested. Oh, your A1C's creeping up there. You're in the pre-diabetic range. See you in a year. And then you come, it's like, well, yeah, it's going to probably go up next year, and then you might be in the medication.
But the doctors, for one, they're not taught how to even ask the right questions, or they don't even know the root causes. And so they're not going to ask about the lifestyle things they need to be asking about. And the same thing applies to the blood sugars, the stress and stuff. I've seen it, to blood pressures. I've seen it really affect blood pressures. It's unfortunate. And some people, it's where you are in your life. Your job. You have to make some tough decisions sometimes. It's like, do I stay in this toxic work environment where I know it's harming me, especially the shift workers? I'm like, if you can ever get away from shift work, do it. And I know it's probably pays better.
Right.
A lot of it, like, man, those paychecks are nice for the jobs that require these types of shift work. Or the people that, I get better pay when I work at night. I'm like, well, that's going to catch up with you. Right. And I've had a lot of patients who have actually said, I'm not doing shift work anymore. I'm not doing night shifts. It's not worth it. Yeah. And I'm like, I applaud you, but that's a choice that people have to pray about and see what they need to do. But that's just not going to turn out well for you in the long run. your health is at risk. And if you don't have your health, you don't have much. And there's been times, with my insomnia where I was just like, if I won the lottery today, I don't even know that I'd be happy. I would trade it. I would give it all away if I could sleep.
Yeah.
That's how, once you get to that place where your life has been altered so much, you realize quickly how much value your health truly has. So keep that in mind, you guys who are working in really toxic places and night shifts.
And there's
all that.
other options. I made a couple, there's for things like cholesterol, someone might say, okay, well, the natural alternative is red yeast rice. And then for blood sugar, it's like
berberine. Berberine will help.
Yeah. So what, coming off of a glucose medication, do you feel like when you're weaning?
Those are great things to use. And I'm always thinking, okay, where historically were humans getting berberine? What were we eating? What were we consuming for it to have that effect on us? And I don't know. I didn't live 1,000 years ago, so there is some documentation. We know a little. We know a lot actually. But I think those are great things to use. They're much less harmful than glucophage or metformin and all of those things. Yeah. So I'm all for those, and I've seen how well it's worked for people. A lot of people have high toxic burdens. I'm working with a lot of people right now who have battled high blood pressure, diabetes, all kinds of things, high cholesterol, and they are so toxic. Like lead, mercury levels just in the red. Yeah. And you're like, well, boom, boom, boom.
Right.
There you go. That's definitely a contributor.
Right. Yeah.
And I was not shocked when I got the results back. Because when you have people who are doing all the right things and they're still having issues, it's like, all right, we got a toxicity problem. But I already knew that when I met these people. I'm like, this is going to be an issue, but we're going to start with the other, the foundations first and see how much clears up. And things do clear up. There's a lot of things that clear up. And then whatever's remaining, it gives you a much better idea of what possibly might else be contributing to it.
Yeah, that's really good. Talking about PPIs, we can talk about those, and just also wanting to talk about like over-the-counter options too.
Yeah.
Are they having the same effect, or is it still doing the same damage to your body? What does that look like? How do we get off of these in a manner that is safe?
PPIs, those were only supposed to be used for 3 weeks tops. I know people have been on them for 10, 15 years. They are highly associated with all kinds of nutrient deficiencies, dementia, of course, because of certain nutrient deficiencies. They do a lot of downstream damage to your gut health. They're not addressing why you have too much stomach acid or heartburn, and often the heartburn is because of too little stomach acid. And so you throw that in the system, you're just making matters worse. And I've had my experiences with heartburn, reflux. I was even put in the hospital with a GI bleed in my 20s. I had just terrible gut health. That was the biggest contributor to it. Food sensitivities and stress. There was a lot of stress. I can only imagine what I was doing in my 20s. Having a good time.
We have a podcast on that too.
Had a really good time in my 20s. And so we do have various protocols to help people get off of those. Some of those are just using completely the natural route, whether it's like zinc carnosine, DGL, which is a licorice extract, marshmallow root, aloe, L-glutamine that's helping the stomach lining. Those can really be helpful when you're trying to get off of those things. Zinc carnosine works like a charm for me. I know people who have been able to address their heartburn issues just by like taking certain probiotics. They're like, man, I take your optimal probiotic and I don't have any more heartburn. I'm like, yeah, your gut health is obviously not where it needs to be. And I know why.
Yeah.
I know what you eat,
Yeah.
and I'm not, yeah. But sometimes it can be very easy. Sometimes we have to use things like ranitidine, which are H2 blockers, and kind of do like a step down pharmaceutical approach. You got a PPI, and then we kind of switch you over to an H2 blocker. And then eventually using the natural stuff too until we can get you off. The longer you've been on them, the harder it is to get off for most people.
Right.
And a lot of people don't want to feel any discomfort at all. You're going to feel some discomfort when you're getting off of these, but it's going to be worth it if you can just suck it up. And a lot of these things that I mentioned, the zinc carnosine, and those can help a lot. I mean, if I get heartburn, I'll take that and something called our GI repair that's got DGL and L-glutamine and marshmallow root. It's a little powder I mix up. I'll take that, and it's pretty much resolves it.
Wow.
Yeah.
Just for
real quickly.
like a week at a time, a month at a time?
No,
or-
that day.
Okay, just by taking
That day.
Just by taking the one
It's like
time.
an as needed.
Okay,
Yeah.
as needed zinc carnosine.
Yeah.
We have a protocol for PPI tapering
Yes.
on our full script as well, and we actually use those two products. We use zinc carnosine and a GI repair.
Yeah.
So
With our patients.
yeah.
And you can buy this on,
Yeah.
purchase this on Full Script. You can go through the website to set up your account, and then it gives you automatic discounts.
Yes.
And then access to a lot of our protocols that we use for patients.
Yeah.
Yeah.
Yeah, that's great. And is that the same for over the counter? Like you're, like a Pepcid, or someone's like, oh, I'm having heartburn, reflux. I'm going to take something quick over the counter.
The products are the same over the counter or not. Some insurance companies will pay for the stuff that you can get over the counter.
Right.
And so, it's the same thing. And what people need to know also is that the symptoms of too much acid and too little look very much the same. And GI doctors used to use a machine to actually test your stomach acid levels when you would come in with GI issues, heartburn, reflux, and they would check it to see where your levels were. Now that does not happen. You just automatically get put on a PPI. They just automatically assume you're producing too much stomach acid because it's coming out of my throat. Well,
Right.
guess what? Your stomach has to be at a certain pH to make this sphincter, the esophageal sphincter, close. So if you're constantly having reflux, it's probably because you're not producing enough stomach acid, and it's never getting the signal to close.
Yeah.
We will have people do baking soda tests if they have that complaint. Any GI issue, or especially reflux heartburn, is do a baking soda test. I mean, it's a pretty good test. It's very simple, and we have the protocol on Full Script. But it's basically using drinking some baking soda upon rising in the morning, and then monitoring for how quickly you belch. It's basically science 101.
Yeah. And if you want to use we have the betaine hydrochloride pills too. If you're like baking soda is a no-go, there's different ways to test that you can
to supplement
assess that.
if you're not producing enough stomach acid. We know how to give you supplemental in the short term as we work on why your gut is acting the way it is.
I love that you said in the short term, because some people might do that and be like, oh,
I have to have it.
Yes, I have to have this supplement to produce more stomach acid so I can digest my foods, which that might be beneficial for them when they're eating certain things or going.
It should be short term though.
Yeah.
Once your gut health is optimal, you should not need supplemental stomach acid, except for people who have had like gastric surgeries. I'm missing part of my colon. That has a big impact on a lot of things. I don't need betaine though. I do take my digestive enzymes.
Yeah.
Helps tremendously to get stuff back on track, but then I don't need to constantly use them.
Right. Yeah, that's good. And we can briefly talk about statins for just a little bit.
Just beat that horse in the ground.
Yeah, I mean, coming off of statins, how does that look?
Sometimes you will see cholesterol levels rise, but there's a reason. Like, first of all, the whole cholesterol thing is a myth. In almost every instant, there are some exceptions, but cholesterol's not causing the problem. It just happens to be at the scene of the crime. So your vessel walls are being damaged. Cholesterol is there to patch up, the damaged wall and recruit other inflammatory cells to help do that.
Yeah.
And so the cholesterol is not damaging the vessel wall. It's there to repair it. But since it's there in the plaque, really 15% of the plaque is cholesterol. Okay. And they have said, oh, that's what's the problem. That is such a fallacy, and there's so much research that shows that now.
What if it's like someone gets their blood work back and they're like, well, I have a really high LDL and not a lot of HDL, the two different types of cholesterol. Is there an issue there that you're like, okay, we really want to get this number down?
Well, I have seen a lot of research that says that even if it's a high LDL, your risk of heart attack and so doesn't even go up. It's not based on LDL or HDL. And I've had talks with cardiovascular surgeons. One who was like, I don't care what your LDL is. Most of the people that I am doing surgeries on technically have perfect cholesterol levels, yet I just did a bypass on them. So and in fact, almost 50% of people who have heart attacks have normal LDLs and normal cholesterol levels. So what else is going on?
Is there certain markers that you can look at that maybe take a deeper approach?
Yes.
To say, okay,
if you're approaching 300 or over, which you could always, that bell curve, you could just be that one where that's what your body does. But from what I have seen, when you have people whose levels are like that, they are toxic and they know it. They don't doubt it because of where they grew up, what they've been exposed to, and your body will produce more cholesterol. The liver makes produce more cholesterol to get rid of toxins. So when I see those high things, I'm like, we got a liver that's trying to get rid of stuff. What's it trying to get rid of?
Yeah. Is there alternatives for that you can, like red yeast rice? You ever talk about that for lowering numbers to a more optimal range?
It's not about lowering numbers though, right? I mean, if you're toxic, the body's doing what it's supposed to be doing, right? It's making cholesterol to get rid of it. So it's like, do you want to hinder that process? Or do you want to go after what's causing your liver to do that in the first place?
Yeah. Which is the right approach to be taking, but it's what's sad about our culture is they don't want to remove the toxins.
It's not easy.
Some people are just like, I don't want to give up this lifestyle or what I'm doing.
I don't want to I'm not removing my breast implants.
Yes, or I'm not going to stop drinking X amount of alcohol.
Yes.
Even though I know my cholesterol is rising. Or
my gut health is terrible. And a lot of times it's gut health related too. I've seen people's numbers come down who were like, I just started eating a really good yogurt and my numbers dropped.
Yeah.
And I'm like, yeah, look at that. Wow.
Yeah.
And then, the red yeast rice thing it's there for people who still are terrified of that cholesterol number because it's just been beat into people, unfortunately. Yeah. And so we've got patients that are just terrified to come off that statin. And it's just, I can only lead them to the water.
Right.
Ultimately, it's their choice. But a lot of them are, I'm just going to say I'm a statin, but I'm like, all these issues that we are trying to mitigate and address are being caused by the statin. So sometimes I have to tell people, there's really not much else we can do for you. I strongly feel that this is related to your medication. We have done this, and this. It's not a matter of taking another supplement or this. This is the problem.
Yeah. Yeah, that's good.
Yeah.
We can kind of talk about medication and addictions to medications and how does that even come about? Why is it so hard for some people to get off certain medications?
Oh, benzodiazepines. I have my own personal experience with that. Clonazepam. That one needs to be taken off the market. There's actually some groups that are that are trying to speak awareness about, Xanax, Klonopin, Valium. All of these things are highly addictive and can be hell to get off of. There's been some doctors I know. One was an orthopedic surgeon who his doctor put him on Xanax because he was having just, a little bit of nervousness, and it was affecting some of his surgeries, and so, but then a little bit of Xanax led to more because you develop, a tolerance, and then if you miss a dose, you're like, the withdrawals are awful, and then weaning off of them is not for the faint of heart. It can take a while to wean off of these. You can do it successfully, but you have to be very, very patient and understand that it's not going to be smooth sailing the whole time, but it is absolutely worth getting off of something that not only are you addicted to, but it's changing your brain's chemistry and the way that the brain works. It's changing its functionality. That is terrifying. So, and there you can even do like EEGs on people and tell that they've been on a certain antidepressant for a long time because it's changed what their brain is doing. I mean, that's what they're designed to do, right?
Yeah.
But you can pick it up. It doesn't look like it doesn't look like what a normal EEG should look like. But the benzodiazepines can be those are ones that you do not want to quit cold turkey. You can have seizures, and you can even die from it. It's a very different class. Like the opiates, if you were to go cold turkey, it is not going to be fun. It's going to be horrible, but you will not die.
Yeah.
The benzodiazepines are the ones where you can actually die if you quit cold turkey.
Wow.
So.
So safety first and foremost.
Absolutely.
When getting off those medications.
And we weren't taught about how addictive these things were in medical school. I know a lot of doctors will just, will just cut back a little bit start cutting back on your Klonopin, half the dose, and you should be off of it in, a few weeks. If you've been on it for a couple of years, it's going to take 6 months to a year for some to slowly wean off of it so that it's not drastically affecting the quality of your life.
Wow.
And usually you use like liquid suspensions and stuff for that.
And I think that some medications, I would say, are kind of psychologically addictive.
Oh yeah.
Maybe they are
placebo effect
helping.
Is strong.
Like for example, I think of skin conditions, and someone gets on antibiotic, or they get on spironolactone, or even birth control, something of that nature. And it's helping, or whatever. It's covering the imbalances, but
it's
what
masking.
You're seeing is helping. And so I think some people can even become psychologically addictive to these medications because their symptoms are gone.
Well, yeah, that's the pitfalls of pharmaceuticals. They can mask your symptoms. Some of them can really well, like that.
Yeah.
But boy, they're going to cause problems down the road worse than your acne.
Yeah.
And doxycycline is often the antibiotic that's used. Tetracycline, doxycycline. One dose of an antibiotic can increase your risk of anxiety and depression dramatically. And then if you have 2 courses in a year, it doubles. I mean, the increased risk of developing an anxiety disorder goes up to like 40%. And that's what I see in these people's timelines. So like, I was on multiple rounds of antibiotics for this chronic UTI that wouldn't go away. I'm like, you're destroying your urogenital microbiome with your gut microbiome. And so, I'm not surprised you weren't just constantly susceptible to UTIs, which often aren't bacterial. They're inflammatory conditions, but everybody just gets put on an antibiotic unnecessarily sometimes. Not that there's not a place, but the birth control, again, we know it's going to start messing with your thyroid function, your gut health. A lot of women will go on to develop depression, anxiety issues. the synthetic hormones they're just, no, don't do it to yourself. Just work hard to uncover why you are having acne.
Or XY,
Or XYZ.
Yes.
Yes.
Yeah.
Yeah, it's not it's not a quick fix sometimes. Usually it can take a few months before you start figuring things out and letting stuff kind of rebalance in your body.
Yeah.
But then boom, you don't have to take any medications now. You made better diet changes, or you stopped using this or that, or
Right.
cleaned up your toxic load, or you got rid of a parasite. I know people who've had acne, and it was a parasite issue.
Yeah.
And why did they have a parasite issue?
Yeah.
I'm like, why was that happening?
Yeah.
Well, probably had some, your body was not doing well to allow something like that to happen.
Yeah. And I think another common medication that a lot of young people are on, young women are on, is anti-anxiety Zoloft, whether it be at low doses or high doses, and it almost makes it impossible to come off of them.
Those are hard to get off of. Those are another one that are changing the way your brain functions in ways that I still don't think we fully appreciate. And it can take a while to get off of them. Some people wean off of them easily, some people don't. I think, though, if you support the body in the correct foundation, using the correct foundational approaches, you have a better chance of an easier time weaning off of those. The thing is that you've got people who are trying to wean off of these, and they're still eating lots of sugar, drinking tons of caffeine, on their phones constantly, on a computer, which is making their anxiety worse. So they're doing a lot of things when I think they're blaming it perhaps on the weaning efforts, but it's probably their lifestyle efforts too contributing to that problem.
Right.
And you always want to go slow with the antidepressant weaning to avoid all the unnecessary blowback and withdrawal symptoms. And I have learned that with some of my patients. We weren't taught that. We just weren't taught about all of these issues that develop and how you need to handle them.
Which is sad, because a lot of people, even myself included, when I was trying to get off an anxiety medication, I did quit cold turkey. Or maybe you run out for
That's
you
happened
can't
to
pick
me.
it up.
Yeah.
You run out and it's 3 days without it, and your emotions are a wreck.
Yeah.
You're like, what is going on with my brain? I can't stop crying for no reason. All these things, and it's like people are having to figure this out on their own without support of, okay, let's focus on these habits while you're getting off. Let's slow down when we're weaning and stuff like that.
And weaning is all. Don't try to go cold turkey. I mean, all the people are just like, I'm just doing it. I'm going to gut it out. Your life.
That was me.
Your life will be miserable.
Yes.
Just you've got to wean off of these. Bless your heart. I'm sorry you had to go through that. I remember going to Nashville one time, and I did not bring that Klonopin, and that was the first time I'd ever experienced anything. I was in the bathroom on the floor, profusely sweating, vomiting. Heart rate was like 120.
Oh my
just cold chills, and I was like, oh my gosh, I haven't had that Klonopin in several days. And I mean, I got back home and I was like, I'm not doing this again. I'm not doing the tango with you ever again. And I'm glad that happened to me, because I learned a very valuable lesson with these medications.
Yeah, I would agree. Yeah, there was a season of my life where I went on, I was on birth control, I was on anxiety medication, I was learning all this stuff about why I didn't need to be on these medications. So I was like, I'm done. I'm getting off everything, I'm just going to, take some supplements for my body. But still, you cannot stop those medications like that.
Well, the birth control, you kind of have to, right? You have to just stop it and know that your periods are going to be
have to recover from
are going to be a little wonky for a few months. Balance
with that.
It usually takes about 3 months, and you're back on track.
Yeah. In my mind, when they have to create a syndrome for what happens when you get off of a medication, because now there's a syndrome, post-birth control syndrome.
Yeah.
Whole host of symptoms that you will likely experience when you get off birth control.
So we aren't taught these things in medical school, because we as physicians would be like, well, I'm not going to put my patient on that. You know, wow, why would I do that? But they don't tell us about all that. The birth control is just one of those things you got to just stop it, and then we support your hormonal balance and rhythms as best we can until that stuff is just, makes its way out and your body starts to rebalance itself. But you got to get off of those.
Yeah.
And the same thing goes for I'll talk about this in another podcast. My recent experience with BHRT, I have no doubts that the doctor that I was working with had the best of intentions, but it was absolutely not right for me. And I had no idea that the withdrawals from hormones could be so absolutely, even the natural ones could be so horrific. And I was only using them for 7 weeks, and it was bad. Like it was almost just as bad as the Klonopin withdrawal. And anytime I tried to just go down a little bit, my body would like freak out, and I'd start having menopausal symptoms I never even had prior to starting, hot flashes and all kinds of weird stuff.
I think that's a scary thing when you are messing with your brain, your hormones, there's obviously safe mechanisms to do all of that, but when you do get off of medications or hormones or birth control, all that stuff, it can be scary to really see how much of an immediate effect what you were putting in your body was having.
And I'm glad I went through that too.
Yeah.
I'm not saying there's not a time and a place, but man, I'm glad I went through that experience. And my mom and I remember talking to my mom about it because she never used BHRT, and she was like, yeah, I had some night sweats at night and it wasn't fun, but she was like, I figured God made this body. He knew what he was doing. He was going to get me through it, and she's been fine ever since. But she's like, you got to stop it. I'm like, all right. I was at her house when I stopped it.
Okay.
I'm like, okay, Mom, I'm here. Do you really want me? She's like, yes, you've got to get off of this. They're not helping you. You've only gotten worse since you were on it. I'm like, I know, but every time I go down a little bit, it's just like, whoo.
Yeah.
So I'm going to just gut it out. And that's what I did.
Yeah.
And the first couple of days were like horrible, and it just gradually kept getting better.
Yeah.
But I was determined. Wasn't going to do that anymore.
Yeah.
And then sometimes it kind of takes that determination.
It does.
And just knowing that, it's going to suck a little bit.
Yep. Yeah, I think that's a good point because there's desperation on both sides. Which is another point I wanted to hit on, because there's desperation if you get to that point where you're like, I need to get off these medications. I'm going to do whatever it takes.
Yes.
However long the healing process takes, getting off of these, I'm going to do it because I know it's best. But I think there's another side of that where, what would you tell to someone who is like, I am so desperate for relief. Yeah. And this medication is the only thing that's going to get me there. Is there a time and a place? Yeah. You just have to, and then we've had these patients where you're like, okay, you're on this medication. We are going to address all the foundations, make sure that those are put in place. And then when you feel like you're ready, we're going to start doing this, knowing that it may not be fun for a little bit, but then it gets better. And I've worked with 70-year-olds who came to us with like 10 different medications, all kinds of stuff. And the last thing that we're working with her on now is an antidepressant that she started to wean off of. Yeah. And she's feeling so much better. So many of her symptoms, but it did not happen for her overnight. She has been with us for close to 2 years. But we got rid of 9 medications, blood pressure medications, thyroid medications, and the last thing is the antidepressant, and which she has started to wean off of, and is doing great. Yeah. So, I mean, it's absolutely, and she was one of those who she was determined to get better and feel better. She had prayed about it, and she came to us, and she had Hannah as a coach, and Hannah's awesome. And they have formed this beautiful bond, They just love each other, and it's been a great thing to see this person just get free of all these meds and doing so much better.
in the later part of her years.
Yeah. And that healing takes a lot of time, like you said.
Yeah, and then we have some that do it quicker than that. You know, it's just everybody has their own pace that they want to go and that they're comfortable with, and you just work with that.
Yep. Yeah.
It just kind of depends. Everybody's unique.
Yeah.
And I'm not going to get mad at you if you're just want to hang on to this medication.
Right.
I'm going to keep encouraging you to get off of it, but I'm not going to demean you or, you know, tell you have to go. Although I have told people there's nothing else we can do. You know,
Right. Yeah.
I'm not going to sit here and keep taking your money trying to fix a problem that is directly related to that medication.
Yep. Makes sense.
Yeah.
So if someone's out there and is like, okay, I'm on these some of these medications, where do I start?
You're gonna want to work with a functional medicine practice. Your doctor probably is not going to be the best person. Whoever put you on those is probably not going to be the best person to get you off of those. I would say maybe if you were on an antidepressant or anxiety med psychiatrist, you know, your psychiatrist probably would be okay to work with. They seem to be a lot more aware of the issues with those meds, although they keep prescribing them, so maybe they don't. But you're want to work with a functional medicine practice and someone who understands why you were even having those symptoms for which you were using those medications, and someone who can get you back on track with the foundations of good health so that the weaning efforts will go much easier, and they know kind of like we've learned tricks over the years that can help as far as like supplement wise or even lifestyle things, you know, whether it is sitting outside in the sun, humming, you know, the nervous system, calming things that we can do, the vagal maneuvers that we can get you to calm down, and just a lot of things that you wouldn't think would help so much, but absolutely do wonders.
Yeah.
And so, you know, it's I'm still learned a lot, and I continue to learn.
Yeah.
Every day it seems. I'm my own guinea pig right now. And so I'm learning for you, and it hasn't been fun. But it seems like that's been my whole life.
Yeah.
So, and then God's using that.
Definitely.
Through, you know, using all those trials, those health trials. I've learned a lot, and I'm just using that to help other people.
Yeah. And we have, you know, like you said, several resources. If you want that additional support, you can schedule a free discovery call and start working with our team one-on-one. You talk a lot about the foundations throughout this whole process, because no matter what you're getting off of, you got to have those foundations in place. So we have our Live Well course and planner.
Yes.
That is perfect for anyone who's like, I don't know where to start. If you're trying to get off medication, you know, start there.
Yes, any patient that comes to us, we're going to have you do the foundations.
Yeah.
So a lot of people will, you know, if you just did the Live Well course and planner, started doing the foundations, you might not even need to see us.
Exactly.
But if it gets rid of a lot of your issues, but not some, then yes, come on in. Now we have a lot, you know, now we can get probably real quick to what is going on.
Yeah.
Once I know you're doing everything right, then we like, let's do some testing. Let's see what we see here, you know.
Yeah. Exactly.
That's appropriate. But yeah, if you need help, you can visit our website, learn more about what we have to offer, either working with us one-on-one or through our programs. And if you think you might want to become a patient, there is a process that you have to go through where you have to schedule a free exploratory call with Paul. The Paul call. It's about we allot 15 minutes for those, and we could just, you know, kind of discuss what's going on and whether we're a good fit, and whether you are truly ready to take on this journey. Are you willing to give up the things that made you sick? And so not everybody gets to become a patient. Sometimes Paula said, I don't think you're a good fit.
Yeah.
And we don't want to waste your money or your time, and we don't want to waste our time.
Yeah, that's great. And we also, like you mentioned before, we have Full Script, which we now have protocols on Full Script. So some of these things we discussed.
Completely free.
We have all of those. The PPI, if you're looking to get off PPI medications or acid suppressing medications.
Antibiotic mitigation efforts.
Antibiotics. As well as stomach acid. You want to assess your stomach acid levels. Do you need stomach acid support?
Right. We've got a lot of things on there.
Yeah.
Like if you have mercury amalgams removed, what you need to do that day and the day after. And
we continue to add more. Too,
yeah, we
do.
Yeah. All right. Okay. Well, hope you learned something. I think we hit it all.
Yeah,
Those are the. I mean, there's always other medications.
Yes.
I mean, good grief, I can't keep up with all the medications.
Yeah.
But you nothing good comes from them. They are altering the way your body functions, and you need I have learned these lessons many times over and over. You just want to avoid them at all costs, and get off of them, and be free.
Yeah.
What freedom is that?
Yeah.
Right? You're not dependent upon an industry that benefits from your illness. Yeah. Okay. All right, guys. Thanks for joining and listening.
I don't take nothing that a doctor don't prescribe. I just take Paxil